Welcome, everyone. I am Dr. Nicole Fowler, and I have the absolute privilege of welcoming you to the 2021 Head and Neck Cancer Survivorship Symposium, hosted by the Head and Neck Cancer Alliance and American Head and Neck Society. Our session today is stretching exercise for head and neck cancer patients. I am Dr. Nicole Fowler, a surgeon with University Hospital's Cleveland Medical Center. I wish to thank Dr. Barbara Murphy for taking part in this seminar discussion, as well as members of her team, including Phyllis Kilpatrick. She is the supportive care research nurse, and Melanie Copeland, she's the supportive care research program manager. I'd like to provide brief introductions to begin. First, let me introduce our presenter. Dr. Murphy is a professor of medicine and director of pain and symptom management oncology services at Vanderbilt Ingram Cancer Center. She is a medical oncologist who specializes in head and neck cancer, as well as in pain and symptom management control. Please allow me to explain the format for today's stretching webinar. Dr. Murphy will demonstrate 30 minutes of stretching exercises. At the 30-minute mark of the webinar, we will then open up the webinar for questions and answers. I want to make sure that you all know, as participants, we would love to invite you all to do these stretches along with Dr. Murphy. We'd like you to welcome, please, we welcome all questions, which you can give to us either via the chat or using the waved hand function. Again, the way to use the chat or the waved hand function is if you go to down to the bottom of your screen, along where it says participants, there is a section there that says QA, or a little box that says chat or raise hand. So you'll be able to get it through there. You may also have a button that says reactions, where you could get it through there. I will be able to call on people during the seminar so that they will be able to be unmuted and ask questions as we go. However, we will focus the first 30 minutes on the stretching exercises themselves. Dr. Murphy, we're very excited for you to get started with our exercises.
Well, first of all, thank you so much for that wonderful introduction. And for all of you who are out there, welcome. I'm so glad you are here. We are about to spend the next 40 or so minutes on a topic that is near and dear to my heart, which is making sure that patients who've had head and neck cancer have good musculoskeletal integrity. And what we know is that treatment can adversely impact the function of our jaw, neck, shoulders, and result in postural abnormalities. So if we don't do something every day or routinely to exercise, strengthen, and activate the muscles in the jaw, neck, shoulders, and in the back, over time, patients are likely to lose function. And so our goal is to give you some very simple stretches, simple activation exercises that you can do that can potentially help maintain your musculoskeletal health long-term. Now, the first thing I want to say before we say anything else is we want you to participate with us. So I would love it if you could find a straight back chair. If you happen to have a trusty rubber band like this, many people have stretch bands, or if you don't, a towel. And then you'll need a wall. If you happen to have some very low weights, like these little 1.5 pounders, bring those along as well. I'm going to put these aside for a second. So the most important thing is what I'm going to be giving you with regards to exercises and stretches doesn't require a whole gym full of equipment. The second thing is you must be very mindful of where your body is at and honor that. So if you start doing a maneuver and it doesn't feel right, it feels strained, it feels as though you're hurting yourself, stop. Really important. And the final thing that I want to say before we move into our exercises is that if you really have very significant impairments and you feel that you really need to work on them in a concerted fashion, you need to call your provider and ask for a referral either to a physical therapist or a lymphedema therapist who could help you design an exercise regimen that's going to work for you. All right, so now we are going to go ahead and get started. We're going to start sitting because so many patients have difficulty doing exercises standing. You can also do these lying down, but we're going to start with sitting. Phyllis, our model here, is going to be showing us exactly how to do these exercises correctly. So it's very important that you begin sitting in a straight back chair. That's going to help you maintain proper posture. So when you start, the first thing you do is create proper alignment. That begins with your base, which are your feet. So your feet should be flat on the floor and they should be pointing straight ahead. You should have your seat firmly in the chair itself because that's your base. All posture, whether it's seated or standing, you have to have a strong base. So your base is going to be the pelvis and the pelvis meeting the chair. And then you're going to lift up out of your base to elongate the spine and to pull the head up as if you have a little rope pulling your head upward. So you want length. What you want to also do is make sure that in addition to being long, you're aligned, all right? So that means the ears are over the shoulders or over the hips. So in order to do that, what I want you to do is roll your shoulders back and down. Okay, that's going to help create a nice long neck, and that's going to help you align your shoulders over your hips. The next thing I want you to do is take your chin and just gently press back into your collar. That's going to help create that alignment. Now, in addition to alignment, length, we need some tone in the core because all of your exercises require that you have a strong core. So what I want you to do is take your belly button and just pull it back to your spine. That's going to give you tone in the abdominal muscles. It's not that you're trying to tighten them down, you're just trying to create tone. This is the pose from which we're going to be doing our exercises. But before we start them, we've done our alignment, perfectly aligned. Now the next thing is taking a few deep breaths. So I want you to inhale, nice deep breath through your nose, and then exhale through your mouth. And inhale and exhale. Take a couple more deep breaths. This will allow you to relax your muscles, and it will allow you to become in tune with your body. It's very important that you start with some relaxation so that your muscles are able to stretch. If you're tense, it's really, really hard to do good stretching. Breathing helps relax. So as you start, few deep breaths, all you need. All right, now, the next thing we're going to do is we're going to start, we're going to go in a sequence. You have to have a sequence that you use routinely. We're going to be starting with the jaw, then we're going to do the neck and the shoulders, and then we're going to move to the wall so we can get a little bit more shoulder, back, and core strengthening. So let's begin with the jaw. The jaw range of motion is forward, back, left and right, up and down, 6 degrees of motion. So we're going to begin with an exercise that will allow us to improve our stretching forward and back. And that's just a simple chin jut. So Phyllis, I want you to jut your chin out and then in, and then out, and then in, and then out, in, out, in. One more. Okay, we're going to be doing five of each of these today. This is really important because radiation and surgery can affect the joints, the muscles that are required for jaw range of motion. The next thing that you're going to do are 5 circles, jaw circles, and we're going to start to the right. And you're going to go right, open, left, back to neutral, right, open, left, back to neutral. Phyllis, I'm going to have you keep going. And what you'll notice is that this is a big circle, which is taking your jaw in its full range of motion. Now you've hit 5, and I want you to reverse. So go in the other direction, which will be left, open, right, closed. This is really important because over time, particularly patients who've had radiation, will find that they develop a problem called trismus. And this simple exercise can help prevent trismus from developing. Okay, so you've done two exercises. The next thing that we're going to do is we're going to work on neck, and we're going to start with a range of motion exercise. And what we're going to do, and you can do this with a rubber band, or you can do this with a towel. But many patients, and I'm going to pretend I'm a patient with very bad posture. Many people do this, right? They jut their chin forward and they curl their arms in and they collapse in their chest. This puts a huge amount of strain on your neck muscles. And we often ask patients to retract their neck, and they can't do that. They don't know how. So if you put a towel behind your head or a rubber band, whatever it may be, and you're going to place it right behind your head, and you can pull your hands forward. And what I want you to do is just pull your head backwards, just very gently against that towel or that band. And you don't want to do it in such a way that you hurt your neck. You want to activate those muscles. One of the things that becomes really important, particularly with these muscles in the neck that haven't been activated in a long time, is to actually learn how to activate them. So this is a stretching exercise or a strengthening exercise, as well as an activating exercise. You can go ahead and let go of that. Another way to activate the neck is what is called the goalpost exercise, where you put your fingers in front just like this, and now you try and jut your chin forward between the goalposts and back, and forward and back, and forward and back. This exercise will again help you identify the muscles that are needed in order to create that proper alignment between the ears, the shoulders, and the hips. Okay, so we've worked on jaw range of motion. We've worked a little bit on activating the posterior muscles of the neck, which has helped us in our alignment. Now we're going to do some very simple neck stretches. So the first thing that we're going to be doing is going to be looking straight down. Now, very important, I want you to roll your shoulders back, pull your belly button in, and take your hands, and I want you to stretch them down towards your sides. And then I want you to drop your chin to your chest. Okay, and 5 deep breaths. And what you should do is you should be feeling this through the muscles at the trapezius muscles. You can repeat that several times. It's a very, very, very good stretch. Head and neck cancer patients very frequently will have very, very tight neck muscles. Right, now the next thing I want you to do, come to neutral, roll your shoulders down and back, tuck your belly button into your back, so you have your core is activated. And I want you to think, lengthen your neck in the front and the back. And then you're going to look up without collapsing the back of your neck. This is not a maneuver where you drop your neck back. That's the wrong way to do it. You lengthen the neck and you basically lift the chin up which causes the head to rotate just a little on the spine. And then when you have your chin up, I want you to jut your chin forward. And what that's going to do is it's going to stretch the muscles in the front of your neck. Phyllis, can you show that one more time? Now, this is really important because this is where your voice box is, right? And when that is radiated, oftentimes it becomes less mobile. And mobility in your voice box is important for swallow function. So we need to keep these tissues mobile and keep them from becoming fibrotic. That will help our swallowing long term. So this is actually an exercise that sometimes the swallow therapist will give you. So we've stretched down, we've stretched up. Now we're going to come to neutral. Roll your shoulders down, belly goes in, tone in your abdomen. And now I want you to look over your right shoulder. And as you look over your right shoulder, what I want you to do is take your left arm and stretch it to the side. And what you will see is that the stretch intensifies when you reach in the opposite direction. Now come to neutral and go to the other side. Stretch, there you go. And remember, a stretch requires that there be pulling in two different directions. It could be a gentle pull. It doesn't have to be intense. But if you release one side, so if Phyllis doesn't do this and she lets go of her arm and she lets her shoulder follow, that's going to keep that stretch from happening. So in your workout, you should do left and right. And then we're going to do a head tilt. Okay, so we're going to do this, do the same thing, shoulders back, belly in, tone to hold us. And this time we're going to take our ear to our right shoulder. Now I'm going to tell you what a lot of people do is they do this. That is cheating. So you want to drop both hands down to your side, and you want to make sure that you are feeling the stretch and you're not releasing the right shoulder. Okay, let's go to the other side, to the left. So we're taking the left ear to the left shoulder. We're extending both arms in order to create a good stretch. And through this whole thing, you are breathing, okay? Breathing in and breathing out. My recommendation is to hold your stretch for 5 breaths. Okay, so each stretch, hold for 5 breaths. And that what you'll find is by the time you get to the 5th breath, those muscles have released some and you gain some additional range of motion. So we've done, for the neck, we've done 1 strengthening activation exercise with our towel or our band. We have done 3 stretching exercises, up and down and up, right and left, and then the head tilt right and left. So the next thing that we're going to do is we're going to go to our wall. So I'm going to remove this chair. And here's the thing, you can do these exercises, that sequence that we just went through, you can do that sequence in 5 or 6 minutes. This is not something that takes a lot of time. Next, we're going to go to the wall and we're going to work again on some stretching and strengthening. So the first thing I'm going to demonstrate for 1 second. I want you to take your feet and place them anywhere between 6 and 12 inches in front of your hip. So it's in front of the wall. And the reason why I want to do this, number one, it works your quads. So you get, this is like double duty. And you bend your knees, but it will allow you to eliminate a little bit of the curve in the low back. And it allows you to rest your back against the wall. All right, now, once you've done that, what I want you to do is we talked about pulling the shoulders back and down. So Phyllis, pull your shoulders up, back, and then down. And what you should feel is the shoulder blades. Turn around for just 1 second. What I want are these shoulder blades to be against the wall, okay? So the shoulder blades are against the wall and they're down. So what you feel is you feel some expansion across the chest. My favorite phrase is heart to heaven. That's where you should be going, heart to heaven. So we're flat against the wall with our shoulders. Now we're going to bring our head back as far as we can without tipping up. If you have to tip up, then that means you don't quite have the range of motion in your neck. What I want you to do then is just go as far back as you can. If you need a little support, you can roll a towel up and put it behind your neck. The final thing you're going to do is exactly what we did in the chair. You're going to take your belly and you're going to push it against the wall. Now what you're going to find is this is a pose where you actually activated quite a number of muscles. You have your legs are active, your core is active, the muscles between your shoulder blades are active. And this is good. We're trying to activate the muscles that are used for good posture. We're going to work from here. So the first thing that will go, yes?
Let me just, I love, this is such a great pose. Let's hold it for a second. I just want to remind everyone, if they have any questions, please put them into the chat. And if you raise your hand, I'll be able to call on you after this next set of exercises. But I'm so hoping that everyone's jumping in there and they've got a good wall to stand against, and these look great. So you're doing amazing.
Good. And by the way, everybody has a wall.
Everybody has a wall.
Everybody has a wall. You may not have a band, but everybody has a wall. So once you're in this pose where you're aligned and you're active and you're long, we're going to do wall angels. Now, I'm going to tell you, not everybody's going to be able to do this, but I'm going to show you optimally what you want to do. Optimally, what you'll do is you'll put your arms against the wall with a 90-degree angle at your elbow, and then you're just going to reach up and you're going to try and touch your fingertips together, and you're still pushing against the wall, and then you're going to bring your arms down. Now, normally you may start with 5 of those. Once you get better, you could do 10, or you can do 15 initially. You can add, Phyllis, you keep going. You can add weights to that. Little baby weights, I would start with, but you can add weights, or you can add bands. And I'll show you a band exercise in a minute. So wall angels are really, really good for strengthening this shoulder girdle. Can you feel that? Mm-hmm. Yeah, it's really good. My trainer loves making us do that. So that is the first shoulder strengthening exercise that I would recommend. Now, people oftentimes will ask, their posture is forward, they can't get their arms back. What do? Well, you do the best you can. You may be reaching just in front of you. That's okay. There's nothing wrong with reaching in front of you. What you're going to try and do, though, is you're going to be pulling backwards. No matter where you are, if you're on the wall, you're pushing against the wall. If you're here, you're pulling backwards. Okay? So that's exercise number 1. Now, the second thing, and I'm going to ask Phyllis to demonstrate this with a band, is going to be an exercise where you're going to pull out. Can you do? and bring your elbows to the wall. This is basically we always talk about the fly, reverse fly. Where you're going to feel this, now turn around, just so I can show them where they're going to feel it, is right here. And what you see now, I'm going to have you hold, your elbows need to be up and pull as hard as you can. And you see how her shoulder blades have come together, and there is a little indentation here. That's what you want. Okay, release, and I want you to do that without the band. Okay. Because I want you to really exaggerate that movement. And see the shoulder blades coming together. Now straighten your hands out. And now they're coming apart. And then pull them together and then apart. This is what you want to do. These are the muscles that you're trying to strengthen. Because for many head and neck cancer patients, those muscles are no longer very strong. So this type, and it's really good to do these exercises against the wall or in the chair, because it keeps you properly aligned and it keeps you from, it gives you a goal. Get those elbows back. Get those elbows back. That's really activating. One of the things to also remember is don't let your shoulders rise to your ears while you're doing this stretch. All right, now the next exercise, so that's working the back muscles. We need to work the internal and external rotators. So I want everybody to just put your elbow gently against the wall. Again, our feet are in front of us. Our back is against the wall supporting us. Our core is active. We've taken our belly. We've pushed it into the wall. Our shoulders are back and down. We're heart to heaven. And our elbows are against the wall if possible. If it's not going to work, okay, then your elbows are in front. That's okay. And what we're going to do is just rotate on the axis of your arms. And you're going to do, when you're starting out, you may do 5 of these. You can work up to 10, or you can work up to 15. What you can also do is you can work up, and we have our little weights. You can also work up to doing this with weights. And these are baby weights. But you should always start with baby weights if you haven't been doing weights. And then once you've done your internal rotation or your external rotation, now you're going to start at your 90 degrees and rotate your hands downward. Phyllis, are you feeling that?
Yes, I am.
Good. I love it. I love it. Okay, now those 3 exercises are really good for shoulder, back, and upper arm strength. The next thing that I'd like everybody to do, and some people are going to be able to do this and some people aren't, but it's really important to work on, is I want you to clasp your hands together. You remember doing this when you were little? And then invert your hands and bring your hands as far up over your head as you can. Now, once you're there, push your hands into the ceiling. That's going to create, and then you're going to create a long line between your hip bone and your hands. Now, some people aren't going to be able to straighten. You may be like this, or you may be here. That's okay. You are aspiring to get your arms as close to straight over your head as you can. So we aspire, we go where we can, and if you can't get there, that's okay. Wherever you get is just fine. And then you release and allow your arms to float down. And that feels really good once you've done that. The next stretch is going to be a wall stretch. So this stretch, you're going to put your hands on the wall, and it's going to be at shoulder height. And what you're going to do is you're going to look over your opposite shoulder, and you're going to just gently rotate until you feel a stretch that's right across the pectoral muscles. This is a really, really good chest opener. And for many head and neck cancer patients, what they find is the front of their chest is very, very tight. They're caved in and it's tight. This is actually what can prevent many, many patients from being able to do the exercises that we were just showing. Once you do the other side, really important to make sure that you work both sides evenly. And so you're glancing in the opposite direction that you're going. You feel the stretch through the upper chest, and you just breathe into it. If we were doing a real class, I would have everybody breathing. We just don't have enough time, and we're doing a lot of explaining here. But the breath work is the most important thing when you're doing stretching, because when you breathe, you get just a little bit of expansion and a little bit of extra stretch. Okay, so let's go ahead and we'll hold that one. And then we are starting to run out of time. So let's see. I think there's only one other thing that I do want out of all of the exercises. One other thing that I'd really like to do is push-ups. Now, not push-ups on the floor, but wall push-ups. And the nice thing about a wall push-up is that what you're going to do, and Phyllis, I'm going to have you do this while I explain it. So you can do a wall push-up with your feet right under you. You can do a wall push-up as far down as you feel that you can go. You can get down to doing a wall push-up on the floor, and if you can do floor push-ups, fabulous. But what I want you to do is I want you to do exactly what we've been doing against the wall, right? So you want a long line, take your belly, push it into your back. So you've created a plank. And now you're just going to do a little push-up on the wall. That's it. So if you do that straight up, okay, maybe you're not taking a lot of pressure on your arms, but you're working on strengthening your body and your core. The further, you can feel that? Good. The further you step out, the more upper body strength is required. The more core strength is required. So this is something that you can bit by bit by bit by bit do a little bit more, strengthening your whole entire body. So I think we're going to end there. I could come up with all sorts of other exercises. I love this. But we did work the jaw, the neck, the shoulders, the back, and we work the core. And if you do very, one of my yoga instructors who I absolutely loved always said, the simple basic things are really all you need. And there's great truth to that. So these are very simple basic things that you can do day to day that can help maintain your musculoskeletal integrity and your long-term functional capacity. So I'm going to stop there, and I'm going to let everybody ask whatever questions they have. And Phyllis, thank you for being my wonderful assistant here.
Thank you, Phyllis. Excellent job.
Poor Phyllis is the one who got the workout here.
She did. So our first question, Dr. Murphy, have you put these down into a handout of some kind?
Oh, multiple people have asked that. We had planned on doing that, but haven't done that yet. And the Head and Neck Alliance has really thought about doing that. But it's a great idea, and we will try and make that happen this go round.
Wonderful. It is a great idea. And I would love to give it out to my patients, and I know our patients would love to see it. So I highly endorse it. The next question, we had a great question from a newly diagnosed patient. So he's asking about the timing of the treatments. Is this something that you would recommend patients do during treatment, such as during chemo or radiation, Or what about timing wise?
So that's an excellent question. Absolutely excellent. So I'm glad somebody brought that up. So you can start doing these exercises from the time that you're diagnosed. Again, you want to be very aware that you don't do anything that hurts, right? But you can start doing these exercises at as you're diagnosed. As a matter of fact, we did a yoga study, and our patients loved our yoga study, where we started yoga when patients started their radiation therapy. And quite honestly, they felt that it really helped them get through their therapy better, because believe it or not, exercise, when just that simple amount of exercise, that simple amount of breathing can calm you down. When people are going through treatment, people really get tense. And when you get tense, those muscles can really start hurting. And so, if you do your exercises, and we have exercises in one of our handouts. They're not quite as detailed as this. But if you do your exercises on a routine basis, if you maintain your posture throughout your treatment, then when you get to your rehabilitation, you're less likely to have major issues to deal with. So if you go for 3 months without sitting up straight because you're tired and you're getting radiation and you're hunched for the whole duration of your treatment, and for 3-4 months afterwards, by the time you get to doing your exercises, you already have some impairment. I think my patients know that one of the things that I'm really bad about is when I walk in the door, I expect them to be sitting up straight. One of my common questions is, are you doing your neck and shoulder exercises? And sometimes the answer is yes, and sometimes no, but I try and keep reminding people it's something to do from the day you're diagnosed forever.
Excellent. Dr. Murphy, in terms of the frequency, so I agree with you. I want them to start and do it all the time, but how often during the day, are we talking once a day, twice a day? What frequency would you recommend?
So minimally, people should take their jaw, neck, and shoulders through a full range of motion at least once a day. Now, I will tell you, ideally, it's good to stretch when you get up in the morning, because you have been asleep. When we're asleep, oftentimes, you wake up with that little crick in your neck, you're a little bit more tight. It's a great loosening exercise. If you do it again during the middle of the day, that tends to be when people are they're strong, they're able to really concentrate on their form. And I also think it's a good idea to do it before you go to bed, because that loosens you up. If you're doing your breath work with your stretching, it can calm you down and it can help you get a better night's sleep. So these exercises, really, when you sit down to do them, don't take more than 10 or 15 minutes. So if you can do it a few times a day, in the morning and at night, and maybe add it in sometime in the middle of the day, I think that's ideal.
Wonderful. We had a question about a percussion massager. Do you recommend use of anything like that in terms of fibrosis, particularly the participant was asking particularly about neck fibrosis?
So you're talking about the machines that will they really deliver a bit of a blow to the tissues.
Correct.
And the biggest problem is we don't know if those are safe in patients who have lymphedema and fibrosis. I don't have any trouble with that in tissues that are not radiated, but I think one of the things that we need to understand about the soft tissue abnormalities that are present in head and neck cancer patients are a little different. We've disrupted normal tissue. We've disrupted normal lymphatics. And we don't want to do further damage. because you can take a problem and make it worse by being overly rough with those tissues. So, you know, you'll hear somebody who said, you know, I was doing just fine, and then I went out and I did this and I strained this muscle, and all of a sudden my lymphedema got worse. Or, you know, a patient who said, you know, I had an endoscopy, and I could really feel that they had trouble putting the scope in, and afterwards my swallowing got worse. This is damage on damage. So we have to be very careful about that. So my feeling would be, until we study these techniques in the head and neck patient population, I would avoid that, because I don't want to see trauma on trauma.
One other question, Dr. Murphy. So I will sometimes recommend heat to do these exercises in the morning, let's say after a shower, where you've been able to, perhaps, heat up the tissues and then do your stretching. Some patients I've even recommend, get one of those rice bags that you could just to warm it first. Is that something you recommend or have talked to patients about?
So you want to be just a little careful for people who have, significant lymphedema. Overheating, it brings more blood to the tissues, and it has to return.
Okay.
So I would just be a little careful in that setting. Oftentimes patients will say where they have the most lymphedema is going to be in their cheeks, the submental area, and in this area of the neck. It is now we tend to have less villus. Turn around. We tend to have less we don't tend not to have lymphedema along these muscles of the trapezius right here. So those tissues are fine. But if you have somebody who has really significant lymphedema, it's going to likely be in areas where there's going to be less concern about warming up the muscles to stretch them, and more concern about, okay, let's not cause more fluid to be deposited in the tissues. So I think it's a good thing when you're stretching the back of your neck and the trapezius and the rhomboids. Oh my goodness, yes, the rhomboids those are the muscles between your scapula. So these were the muscles when I had Phyllis do this, where you pull your elbows back, and these muscles here, those will often get very, very tight. And you can actually get trigger points, which, by the way, you can have the trigger points injected. But heat there is fabulous. That can help relax those muscles.
Excellent. We had another patient ask about posture shirts. Is that something that you recommended for patients?
So, well, there are all these devices now. There's now a little a device you can put on your back that vibrates if you slump. So it's very interesting, because the old wisdom was that you didn't want to use techniques that let you avoid strengthening your core muscles, right? It was always, don't use a neck collar, because you're going to rely on that. You're not going to develop strength in the muscles of the neck, and some of these support garments are people would make the same argument. I actually think a little differently. One of my colleagues, Dr. Klein, and I have been talking about that. She's a physiatrist. There does come a point where people have muscles that are really not strong enough to hold them in proper alignment, or at least not for long enough. And so while people are developing those muscles that allow them to sit up straight, having devices that help support them in the proper posture may be the best thing to do. Because if you're at the end of the day and you're exhausted and you're hunched over and you just don't have the strength to bring yourself into proper alignment, I would rather use a figure 8 shoulder girdle, or one of the various and sundry devices that allow you to sit up straight so that you're properly aligned, as opposed to letting you sit in a bad posture for protracted periods of time and just hope you'll eventually have the strength to get out of it. And there comes a point where it becomes a self-fulfilling prophecy, where you become fibrosed into a position that no matter what, your muscles are not going to be able to get you out of that fibrosed position. So, long story short, I'm being wordy. I'm known for this, but the important thing is to maintain your posture using what techniques you need, simultaneously working on the strengthening component so that to the best of your ability, you can maintain that proper posture without added supports. So everybody's balance between those is going to be a little bit different. And as long as you're working on your strengthening, if you need those postural supports, I would consider using them. And if you have any questions to whether or not they're right for you, talk to your clinician, and you can get in to see a physical therapist who can help you out.
Excellent. We had a question from a patient on if Medicare would cover ongoing hands-on physical therapy, that they do daily exercises and stretches, but the hands-on massage helps. Do you know about that?
Well, it's a real problem. And various insurance companies and various programs have different rules and regulations with regards to that. So the paradigm right now is and that's for swallow therapy, lymphedema therapy, physical therapy, is that the physician writes an order and goals are set by the lymphedema therapist, the physical therapist, whomever. And they undertake a prescribed, whatever they prescribe, whether it's twice a week for 4 to 6 weeks. And then at the end of that, they have to assess and see if they've achieved the goals. If they've achieved goals, then the patient is discharged to self-care. They haven't achieved goals, then they can request additional coverage for additional physical therapy or swallow therapy or whatever, as long as they're moving forward. If there's no forward movement, then chances are more physical therapy, swallow therapy will not be undertaken. None of these are models where a patient will undertake physical therapy, swallow therapy, lymphedema therapy, and then be reassessed 3, 6, and 12 months later to see if their needs have changed. A physician can say, I found a new problem, I'm going to send you back. Or you have, you've slid backwards, we need to get you back in. They can write an order. Usually there are only so many sessions that you can get in a year. What we are investigating, though, are what are called hybrid models, which I think long-term is what we need to be doing, which is to say, we're going to do some physical therapy or some lymphedema therapy or some swallow therapy, and I'm going to teach you how to take care of yourself. And then I'm going to see you back in 3 months and see how you're doing, because we all know we're not static.
Right.
Some of us are going to get better, but some people are going to find new problems or get worse. And so that hybrid model where there is a follow-up assessment is a model that I think a lot of people feel is likely a more optimal model, but at this point in time, the benefit of that model has not been demonstrated. Hopefully we will be able to demonstrate that that's effective, because I think most patients feel that if they go back for follow-up, it really helps, not only with motivation, but making sure they're doing the exercises right, making sure that there isn't something new that they need to be adding to their little portfolio of exercises.
Excellent. One last question. Are you aware of any exercise that reduces excess mucus flow suffered by many of our head and neck cancer patients? One of our patients asked.
So So one of the problems that really comes under the purview of the swallow therapist. So one of the problems with secretions is the ability to handle secretions. So if you do not swallow well, there are lots of things that contribute to this. So I'm going to reduce it down to just one item that's kind of pertinent to our discussion here. But if you are unable to swallow effectively, what can happen is the secretions can pool in the back of the throat. And when they pool, they harden. When they harden, it becomes very difficult to cough them up, to expectorate them. So so this is really the worse somebody swallows, the more problematic the secretions become. And so swallow therapists, good swallow therapists can help patients with what is called handling secretions. This can be a real problem with patients who have oral cavity tumors, whose tongues don't work well, or who have deficits. And patients will talk about drooling down the side of their face because they can't handle the oral secretions. So there are a whole bunch of other things that contribute to this, but one of the things I always make sure is that we've looked at swallowing as a component of this particular problem and make sure that we've addressed that if it is a part of the problem with regards to secretions.
Excellent. Well, we've got a question from the audience. Richard Garcia had his hand raised, so we will allow him to unmute and hear his question.
Can you hear me now?
We can hear you, Mr. Garcia.
Yes.
Okay. Apparently that was an accident. I didn't know I raised my hand. I have enjoyed the presentation, and I thank you. I'm really lazy. I've gone through most of this with therapists, and I find it very hard to do my exercises. But I have found if you can find the appropriate work, that you can do these stretches and do these exercises while you work. I know that sounds, but it has to go back to awareness and what you're doing. But it can be as easy as pruning bushes or even pulling weeds. But pay attention to what you're doing, you can get some of these exercises done while you get something done. If that
Absolutely.
makes sense, like
Yes.
doing housework.
So you're bringing up a really good point, and that is, now I still think that you need to do the stretches, and the reason being is that it's really interesting how we think we take our joints in full range of motion, but we don't. One of the exercises that I wasn't able to get in was just the simple shoulder roll exercise.
Right.
And it's amazing how with our day-to-day activities, even if we think that they're robust, they don't manage to consistently get all of these joints through their full range of motion, and will often miss certain muscle groups. That being said, you are absolutely right. There are ways of augmenting the stretches and the strengthening exercises and the activation exercises with all sorts of different things. And whether that is gardening, which is fabulous for you, good for you, or whether that's working in your shop, or whether that's going out fly fishing, playing golf, whatever. Those are great ways of working your body that keep it strong, flexible, and trained up.
Right.
So I approve of what you're doing. Just add your exercises.
Yes, manual labor is the key. Whether it's picking fruit or raking your yard, if you pay attention to what you're doing, you can get those muscles working. At the end of the day, you're tired and you got something done. And you didn't spend a lot of money down at the gym, you know, or
Yes, you're right. Don't tell my trainer that.
All right. Thank you, Gordon.
Thank you so much, Mr. Garcia. We really appreciate your question. This has been just an absolutely wonderful session. I know we ran a couple minutes over. I appreciate everyone staying with us and allowing us to go through some of those chats and questions. I just, to wrap up, I would just like to say thank you to all of our survivors and their caregivers for your attendance here today. A special thanks to our panelists, Dr. Murphy, a special thanks to Phyllis, great job, absolutely terrific, as well as the Head and Neck Cancer Alliance and the American Head and Neck Society for their time in organizing and hosting the webinar. Thank you also to our sponsors that you'll be seeing as we put up the slide. Here are our sponsors, and we want to thank all of them. Thank you, Dr. Murphy. This has been a delight.
Thank you so much.